Hello, guys. How's everybody doing? Good afternoon. I guess it's afternoon now. I hope everybody's great. I'm just gonna share my screen. Oops. All right. So I hope everybody's doing great today. It's been a crazy couple of weeks. It feels like a month since we did the last webinar, to be honest. The last 2 days feel like a month, but I know everybody's feeling the same, and I hope this brings some inspiration and light to everybody's day. I know a lot of you have been on for the 4 weeks preceding this, and there's some couple of new faces, so thank you for joining us. I thought today, we've been focusing the last 4 weeks on a lot of the COVID questions and a lot of the experience I was having with the patients, and just kind of the information was just one after another, and I wanted to get it out there as soon as I could to patients to be able to empower them and to take action for themselves and their family. Today, I thought I would focus in more on what the initial reason for Wellness Warriors was created for, was for me to create an intimate atmosphere of sort of group learning and community for us in the holistic world who are constantly trying to self-educate and learn as much as we can about what we can do for ourselves and our families to stay healthy. Really hone in on the different tools each week, and start to kind of be less about what was in the moment and more about what we can do proactively moving forward in everybody's health. And for those of you who know me, know that I have a long journey through medicine, EMS, emergency medicine, surgery, critical care. And then I always say, then I saw the light and went holistic. Integrative medicine is what I practice, and I think of myself like a partner. I like to partner with my patients, listen to their story like a detective, listen for patterns, red flags, what's going on in their health that's less than optimal. What can we do to optimize their health, their well-being, and really just take care of the whole person. And that's what the whole practice is focused on. And I want this program to be that for everybody, where I can just literally get more information, data, studies. Everything we do in my practice is evidence-based medicine. And the biggest criticism of integrative medicine is there's not enough science to back it up, and it's just simply not true. I felt so passionate about this that when I went back to medical school at 40, which was insane, one of my physics professors, George Einstein, literally related to Albert Einstein. Betsy's heard him before. He sounds just like George. I wish I had a picture. A little bow tie, amazing accent, brilliant physicist. He had done work with thermography at NASA. And he heard about me talking about thermography in my practice and the success I'd had with women and, working towards preventing breast cancer. And he was just like, Christine, you have to do your PhD with me. You have to. And I was like, how am I going to go home to my husband and be like, yeah, honey, I'm 40. I have 2 kids in high school. I have a busy practice. I'm doing my MD, but I'm just going to go ahead and do a PhD too. Needless to say, I'm married to an angel, and he gave me clearance, and it took me 3 years, but I always feel that research is where we're going to make the biggest impact and really change the face of medicine. And I had been using thermography for years. It's been 10 years now. And I think it's the most valuable tool that I have in my toolbox to be able to get a picture into someone's physiology, right? How is their body functioning? Everything we do in functional medicine is to optimize the function. So for me to have one picture telling me about all the organ systems and how that body's actually functioning, where the deficiencies might be, where the imbalances might be, for me, it's priceless as a practitioner. I mean, I don't understand why everybody doesn't have this in their practice, to be honest with you. So I did my PhD research, and it was called, it's a long scientific title, Digital infrared imaging, which is thermography, nutrient levels, genetic testing as a tool to stratify risk, implement and monitor the impact of the breast prevention protocol. And we're going to go through that today. I'm going to present my research to you. I'm very excited about it. I did a small study at the time, but do hope to start a nonprofit in the next couple of years and really do 100 women with 100 control to really be able to publish this data and get it out to the world. over the years, when I first got into integrative medicine, my focus was holistic cancer care, cancer prevention. It was very much about cancer because I had lost my sister-in-law to cancer. So it was sort of near and dear to my heart. And practicing in Long Island, breast cancer happens to be the majority of what I was seeing at that point back in 2008. And so as I, took care of a patient, did the research, put protocols together, over the years, I kind of developed what I would consider, the same things I would use to treat and encourage a woman who has breast cancer are the exact same things I would use to help prevent breast cancer. So vitamin D, we're going to talk a lot about today. We've talked about it in every single lecture thus far. And Michelle sent over a great last minute article that I added to the bottom of the PowerPoint just to kind of highlight how important vitamin D is. I can't harp on this enough. I'd scream it from the mountaintops. I honestly think, we did a lot of things to take care of our patients with COVID, but this was the one thing that everybody was doing. And I do believe it is very important in helping you navigate this virus, as well as helping prevent breast cancer, prostate cancer, colon cancer. And as the article shows, you'll see later on things like MS and diabetes, and it hits everything. So vitamin D is really important. Getting the levels checked, very important. And if you haven't heard the prior lectures, I go into detail. I present a lot of data. Good to go back and listen to them. Iodine. Iodine is very deficient in the American diet. We really don't do a lot of seaweed. We don't do, nobody ever uses Morton's iodized salt anymore. Everybody's using great Himalayan sea salts and all kinds of fun salts. Iodine is very deficient, which is why most women have dense breasts or fibrocystic breasts. Even though everybody has them in the US, it's not normal. I found that simply replacing iodine in the diet, as well as topically using it on the breast tissue, has been the way that we get rid of dense breasts. I mean, most of the women doing thermography all these years notably minimize density, as well as seen on mammogram, less density. And we're going to talk a lot about that. My breast roll-on, which we're going to talk about, which is a Sacred Frankincense oil combination. Obviously, anti-inflammatory diet. I've talked a lot about diet. I think diet is, 80% of it, and stress is 20% of it. You can't do any of this stuff without the diet piece. Natural deodorants, a lot of women don't even realize that they're putting aluminum and a lot of chemicals right under the arm. This is where all the blood vessels and all the lymphatics come to and from the breast. And so just being able to switch somebody off into a natural deodorant is a formative step in them having healthier breasts. Exercise, very important for getting lymphatics going. I'm a big fan of rebounding, where you're jumping on the little trampoline. Anything that's going to help your lymphatic drainage, massage, all of those things are really wonderful. Dry brushing is something we teach women to do manually, where you're just literally using a dry brush to help the lymphatics get moving. I think of lymphatics like the plumbing. You just want to keep it moving. You don't want it clogged, So anything you're going to do to keep the lymphatics going throughout your whole body is going to be beneficial. Serial thermography, which we'll talk a little bit about how I did it in the research. Stress relief. I think we could all use a little extra stress relief this week. And detox. Detox is very important. We know that toxins are linked to cancers, all different kinds of cancers. And so helping the body get rid of those toxins is incredibly important. Thermography. So what is it? It's a camera, basically, that takes a picture. And what it does is it looks for heat. Plumbers use this to look for leaks in the wall. Mechanics can use this, plane mechanics. Law enforcement uses this to see perps in a building by following their heat signature. This is a technology, they used it at NASA, that they use all the time throughout different things. But with the body, it's basically non-invasive. It's literally a picture. It's 100% safe. It's highly sensitive, totally pain-free. And it's different than all the other tests. It's about physiology, and physiology is how the body functions. As opposed to anatomy, you're going to think MRI, CAT scan, ultrasound. Those are tests of anatomy because they're measuring the organ, they're measuring the lesion, they're telling you where it is in the body. There's a lot we can tell about anatomy to see if it might look like a cancer. But really, this is the only test that looks at physiology, which obviously how your body functions is very important. The history of thermography. So you would think this is a new thing. It's not. It's been around since mammogram's been around. 1959, FDA approved it in 1982 as an adjuvant assessment for breast masses. 2006, peer-reviewed musculoskeletal guidelines were published. 2012, another peer-reviewed guideline for breast thermography itself came out. So this is not a new technology. It has been around a really long time. This is literally a picture of the camera, and that's a picture of the scan itself. We use the FLIR camera, which is German, and I think it's absolutely the best on the market. So we can see a lot. We do a full body thermography, which looks at everything from, you can see this patient in the middle has back pain, a lot of upper back pain. The head picture here, you could see the carotid arteries have inflammation in it. Now, if your doctor's suspecting you have a carotid blockage in the artery that runs right here in your neck, they're going to send you for a duplex, which is an ultrasound basically that measures the plaque in the arteries. The conventional test, the ultrasound, is negative up to 49%, meaning if you had 48% blockage in your carotid artery, they're going to send you home and tell you to come back next year. As far as I'm concerned, nobody should have 20% blockage in their carotid artery walking around not knowing any better. This shows inflammation at 5 to 10%. That's when I want to find it, and I want to put a plan in place where you're taking a good fish oil and you're eating a Mediterranean diet and you're preventing problems down the line. Heart disease can be reversed within 90 days. It's proven. Dean Ornish did the most work on that. You can look him up. It's amazing. But you don't want to find it when it's 49, okay? You don't want to find it when the only option is to do surgery on your carotid artery with a very high risk of stroke. Lower back pain here, we've got this vein, it's a little cut off on the bottom here, but we could see phlebitis in a vein. This one, the ankle's a little cut off here too, but that's ankle inflammation. This is a great picture of a leaky gut. You can see almost like the loops of bowel in the middle that are pointing at the camera. That's where the small intestine, this person probably has a significant gluten issue. And then up here, we've got some trigger points. And then we've got this little cold spot in the middle. This is what we see when people are stressed out. It shows up on thermography that you are under a lot of adrenal stress, which I don't know of any other test that can show me that you're stressed out. And shockingly, it shows up a lot in New Yorkers. I can't imagine why. Again, this is not just for women. When I first started my practice, it was probably like 90% women, 10% men dragged in by their husbands, by their wives. But most, I would say it's probably 40, 60 men come now. Men are starting to be a lot more proactive with their health. And they don't want to feel tired. They don't want to feel sick. This somebody who has probably, when we did their blood work, we showed a lot of autoimmune. We saw a leaky gut. We had a lot of food sensitivities. The before and afters for thermography are amazing because people get to see the impact that they made on their bodies. So a picture's worth 1,000 words, right? Fibrocystic breast shows up. I can see if the right breast is more dense than the left. We see patterns that we consider neovascularity, which is like a little blood vessel coming to feed kind of bad cells in the middle. So it's sort of like a circle blood vessel look. I'll show you some before and afters as we go through. Lymphatic congestion, that's going to be under the arm. Sometimes we can even see it in the abdomen. The carotids, cool spots suggesting hypofunctioning, like we were talking about the adrenals being hypofunctioning. We're going to see that cold spot. We can also see hypothyroidism with a cold spot. I have picked up a lung cancer in the past that showed up as a cold spot. That was not picked up by CAT scan, MRI, and went on to be diagnosed 3 years after the fact. Full body patterns can be suggestive of food sensitivities, autoimmune disease. We literally see everything. Lymphatic congestion is important. So your lymphatics, we can do these overlays over the patient's images and show them where things are in the body. We could show them where their colon is. We could show them where their small intestine is. Lymphatic congestion means your body's not taking out the trash. You're toxic. You need to move those lymphatics, or we need to detox. Hormonal disturbance is a big complaint for a lot of women. We know that toxins disrupt hormones. And so women come in and they've got this estrogen dominant plant. It's almost like she's got a sunburn on her chest with all this spottiness. That's someone who's got a high estrogen. So if we talked to her and took a history, she would have terrible PMS, terrible cramps, breast tenderness. And that's when her estrogens go too high before her period. And this is the pattern that we will see on thermography. And again, we want to be able to bring those estrogens down because we know estrogens over a long period of time can increase risk for estrogen dominant breast cancer. So that's a really big key. I see a lot of young women with these symptoms, and they just think having bad PMS is their life. Like that's just what they think. And then you put them on a supplement that brings down the bad estrogen, and a month later they call me crying because they didn't even know their period was coming. It's a lot of suffering going on for no reason. Food allergies, we talked a lot about leaky gut in the last 4 weeks. So you guys know, I feel like that's the underlying cause, the underlying condition that I feel a lot of COVID patients probably had, underlying imbalances in the gut, underlying autoimmune conditions that they didn't yet know that they had that may have left them to be more subject to that virus. The radiology reading, we see everything, head and neck, we see sinuses, we see TMJ, we can see dental. I picked up probably a dozen dental abscesses that the patients didn't even know they had. Eye issues, neck issues, breast, obviously congestion, dilated ducts, hormonal imbalance, generalized inflammation. Chest, we can see acid reflux like nobody's business. And most people do not know they have it. It's silent acid reflux, which is something that if it's burning your esophagus for years and years and years and you don't know about it, could definitely become a problem. We've got chest, heart, lungs. Like I said, I picked up that lung cancer long before it became big enough to be diagnosed. Shoulder issues, we can see sprains, strains, a lot of people come with joint pain, and we're able to identify that they might have a systemic inflammation. It's not just the right knee that they want to do surgery on, it's all the joints are inflamed. We take care of that, they get better. Stomach, liver, pancreas, spleen, intestines, female organs are very easy to see. We've seen some pretty dramatic pictures of ovarian cysts, and back injuries are rampant. This is a picture I presented. I figured I'd put it up here again. One of the prior lectures on COVID, that someone actually got a picture with thermography of somebody with active COVID virus and lung symptoms. And it kind of looks like a 3-pack-a-day smoker, to be honest with you. You can almost make out the outline of the lungs themselves. So that's fascinating to me. So stratifying the risk. So if low vitamin D increased risk for breast cancer, obviously we're going to check those levels and replace that vitamin D. If fibrocystic breasts increase risk for breast cancer, we're going to take a picture. We're going to put them on a protocol to get rid of the fibrocystic breasts. If neovascularity is my suspicious sign on thermography, I'm going to give them something to help get rid of those new blood vessels, shut them down, get those bad cancer cells to starve. Subjective hormonal symptoms, if they're there, we're going to treat them because they're just a sign that the body's out of balance. And then MTHFR mutation is something I added in late in the research study, because it is something I had learned a lot about in my practice. MTHFR, as you all know, I'm very passionate about detoxification. And there's a gene that makes it difficult to detoxify. We, again, talked about this in one of the prior lectures. All my patients get screened for MTHFR, and it's always addressed. But I felt it was important to include in this risk stratification for these patients. So we did these, we did these tests. We did a lifestyle assessment, basically looking at their stress levels, what stress tools, how they're eating. Then we did the imaging. We did the imaging initial 3 months, 6 months, 12 months, and 2 years. And we had all that progression of change in the breast. The protocol included vitamin D, Lugol's iodine, both topical and oral. The breast roll-on, the breast self-exam was encouraged, and stress relief. All things that I think are crucial to preventing really all disease. Vitamin D, vitamin D, vitamin D. Can't say it enough. So important. A lot of companies are now coming out with spot tests that you can actually order to your house and check your vitamin D at home, which I wanted to do like 10 years ago. They're amazing because it's very important to check your levels. You can take too much vitamin D. It's a fat soluble vitamin, so your body's not like a water soluble like vitamin C. You're just going to pee it out. So you want to make sure you get your levels checked and then adjust. I recommend doing it 2 or 3 times a year. So the vitamin D, this was one study. I had been noticing vitamin D levels decrease sharply over the last 3 years, and I wrote it off to pollution. Was pollution creating a filter that made it hard for the UVB to get through, to get to our skin, which is why everybody's vitamin Ds were plummeting. I believe this to be true. This was the only study I could find anywhere. I was out of the Middle East about linking air pollutants and decreased levels of vitamin D. I thought that was very interesting. Nobody's really looking at this. I think it would be an interesting comparison now to see what's going on, because the pollution has clearly cleared with us being locked in the house for the last 9 weeks. And I think that there will be an impact. I think the sun will be more effective. I know I got a sunburn last week. I never, ever get sunburn. So I can tell you with certainty, my skin was more sensitive to the sun. I have to see if that impacts my vitamin D level. These are just some of the studies. There's studies, significant studies. This is specific to breast. There's significant bodies of literature on breast, prostate, and colon cancer, because those three cancers are actually very similar in nature. Those would be, I think, the most studied cancers for vitamin D. I think that affects all cancers, but I think that those are the three that have the most data out there, excuse me. Iodine. Okay, so you have to be careful with iodine. If you have Hashimoto's or Graves' disease, which is an autoimmune process of the thyroid, iodine is very good for the breast. It's very good for the ovaries. It's also really good for the thyroid. Now, if you have an autoimmune process, so your body, because of confusion in the gut, has started to attack your thyroid. If I give you something that's going to make your thyroid work better, the autoimmune process can get worse, because it's almost like lighting up your thyroid, and the antibodies are like, fight harder, right? So I always treat the thyroid first. I get the thyroid under control, and then I add the iodine in to help with the fibrocystic breasts. There are some people who have Hashimoto's, the antibodies are very low, their diet's really clean, and we can use topical iodine right away, and it does not cause any issues. But I'm very cautious with that. So I always put that out there to people, because it is something you have to be aware of. Really, the only foods that have any iodine are going to be like your seaweeds and your shellfish, which are toxic coming from the ocean. So I really don't feel like I could tell people to go eat a ton of that. The data is really out there, all kinds of information on fibrocystic breast, dysplasia, which is precancer, and iodine deficiency. I have 100 pages of research articles on all these different studies. I just picked little ones that you guys could look back at. But the iodine definitely impacts cancer in the petri dish. It impacts fibrocystic breast in animal models, as well as breast cancer animal models. So it's something that I feel is the key to getting that fibrocystic density. Some women have such dense breasts, it's like rock. It's so uncomfortable. They're uncomfortable. And within usually 2 weeks, by the time they take the thermography and call me for the results, they're already literally feeling a difference in their breast. They feel lighter, they feel softer, they feel better. So it works very quickly and very effectively. Sacred Frankincense is Boswellia sacra. It comes from this tree in the Middle East. Frankincense, it's been around since the Bible, right? They gave it to Jesus. People knew it was good for you, right? It's very anti-inflammatory. Boswellia is one of the most anti-inflammatory things. And the breasts, luckily, are very superficial, right? So this would be difficult to get to the prostate, right? I have used Sacred Frankincense suppositories for prostate cancer. But the breast, it's easy. I literally have my little roll-on. I'm under the arm. I'm around the breast every morning. Used to put it on at night. I'll tell you a funny story. When I go to bed, my husband would be like, "Oh, Christine, you smell like church." And I'd be like, "If you like my breast, you'll just get over it." And then one day I was like, I guess I could put it on in the morning. So you don't have to put it on before bed. It's not great for the bedroom. But the Boswellia sacred studies are amazing. There's one researcher who's done like 3 or 4 studies showing that apoptosis is which basically destruction of a cancer or precancer cell from sacred frankincense, showing we talked about that neovascularity, and a lot of the chemo agents and targeting for cancer to shut down blood vessels to like Avastin is a medication that shuts down blood vessels to a tumor so that the tumor can die. So it works sort of like a natural anti-neoplastic topical. Like we talked about, the breasts are so topical that you're literally treating. So I have women do their thermography, start putting their frankincense on once a day. Then when they get the results, let's say there's a suspicious spot, on the right breast at 12 o'clock. I have them put a little extra dab right on that. Or if they feel something, I have them put that right on there. And that's basically their breast roll-on protocol. So there's a lot of studies to back it up. There's also studies on bladder cancer and pancreatic cancer that are coming out from Sacred Frankincense. Very exciting. Anytime I see anybody that has any blood in the urine, I say, put a drop or 2 of Sacred Frankincense in your water, drink it once a day. 9 times out of 10, the blood goes away. So would it have gone on to become a problem? I just don't let it go there. So it's really effective, very safe. They baptize babies with frankincense, actually. That's what they use to baptize babies. So they've been using this forever. And the reason they did that, I went back and did some history on it. is that it would boost the immune system. And so they wanted to baptize these babies in case they got sick, and they did notice that it made a difference. So that's kind of cool. So self-exam, I ask every woman, do you do self-exam? And I would say 75% of women, if they're being honest, say no. And I always ask why, because I want to learn from them where the resistance is, where is the knowledge gap. A lot of people are afraid. They'll literally say, I'm just too afraid to look. A lot of women will be like, I don't really know what I'm looking for. And I never really was taught how to do a breast exam. And so I just go through it. You know, it's once a month, not before your period, but after. You just want to feel, it's better when the skin is wet. You want to feel around the breast, and you want to feel what you feel like. There's no right or wrong. You want to know what your normal is. If you know you're normal, 3 months from now, you do an exam and something feels different, that's when you call your doctor. So it's not really like, you don't have to be crazy about it. You're feeling you're normal. You want to get to know what's normal, and then you'll know if something's abnormal. And it is really important to do. So mammograms, I don't think mammograms are the answer. This is not a replacement for a mammogram, because it is a very different test. Like I said, it's a test of physiology, and the mammogram is going to tell me, is there a mass? Where is the mass? How big is the mass, right? Neither test can diagnose cancer. The only test that can diagnose cancer is a biopsy. So mammograms, I think that we're putting a lot into early detection. Every woman needs a mammogram, 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 mammogram. And, you know, this huge study was done over a 25-year period of time, almost 50,000 women. And what they found was 505 women died who were screened every year. 500 women died who were not screened. We didn't change the death rate, right? The mammogram didn't change the number of women that died from breast cancer. And for me, that's unacceptable, right? That's not the answer. You know, the Preventative Medicine Task Force back in 2009, they make recommendations. They look at the research, they make recommendations. The AMA doesn't always take their recommendations, but they're just sort of a non-attached, you know, no political influence, no bureaucratic. They just kind of look at the data and present recommendations. And in 2009, they suggested that we change it and only start mammos at 50 and stop at 74. They also recommended that we potentially should be doing them every 2 years as opposed to every year. And obviously, if women had a immediate family member who had breast cancer, that's different. Then they said start at 40. The reason that they made those recommendations to change the protocol was that there was a concern about the radiation. There was a concern about overdiagnosis. And, you know, they weighed the pros and cons, and they said they thought that changing their recommendations would minimize the cons, you know, basically minimize the risks associated. And this is one of the women who does a lot of fundraising, National Breast Cancer Coalition. And, you know, she said we get sidetracked by the effort, a focus of getting mammograms. But if we screened every single woman, we would have not stopped cancer. And that was one of the things that really bothered me and kind of prompted me to do my research is I don't want to get early detection. I don't want to detect anything in my breast. I want to be proactive and do everything I can to prevent it from ever happening. And that's why I thought it was very important to do this research, to give women tools. It's not just about waiting till you're 40 or 45 to go get a mammogram. You can be doing things starting in your 20s that could potentially reduce your risks and increase your breast health. So the breast cancer funding, 5% goes to research on environmental causes of breast cancer. As far as I'm concerned, that's not enough money. And, you know, we raise a lot of money in breast cancer research. Chemicals are a big factor. Chemicals are absolutely, why is Long Island a hotspot? I absolutely believe that toxins play a role in that. I don't think it's necessarily the whole role. I think stress has a little bit to do with it as well. We tend to be a little stressed out here in Long Island, New York. But the toxins are huge. And the data on the toxins is overwhelming. I mean, parabens, I used to coat my kids on, 50 sunscreen, right? All over my little baby's breasts, to be. I didn't know the parabens were involved in the origins of cancer, right? BPA is as bad as DES. I don't know if anybody remembers DES babies. That was a medication we gave women to try to prevent miscarriages, which caused cancers, female cancers in them, their children, and their grandchildren. And this is a medication that we prescribed in the medical field. So it just goes to show you, we mess up sometimes. We don't always know the right answer. It's not intentional, but a lot of this we learn as we go. But BPA, when you compare it in animal models to DES and the effect it has on cancer, is comparable. When I read this, I cried because I used to, whatever, I drank out of plastic bottles before I knew any better. And I warmed up my baby's milk in, a little plastic breast milk in a plastic bottle when I had to go out. I didn't know that I was pushing BPA into the breast milk, but now I know. And you can get rid of BPA and you can detoxify parabens. And that's why I get crazy about detox and how important it is. But that's really important to just move away from plastics, drink out of glass. I got my glass bottle right here. Genes load the gun, but environment pulls the trigger. So I'm a big believer that just because somebody in your family had something, there may be a genetic weakness, but it doesn't mean that you're going to get that disease. It means you just have to work harder to not get that disease. You have to become more empowered, more educated. You have to go a little bit above and beyond the average person to minimize those risks. And the BRCA gene, a lot of women get tested for BRCA and they're BRCA negative and they get breast cancer anyway. We know in medicine, it's like, what's going on here? We know there's other genes that increase risk. I think the MTHFR gene is definitely one of those genes. I think there's probably several. But this gene, if you have a mutation, then you can't get rid of toxins very well. You're just an impaired detoxifier. So if I'm putting parabens on my breasts and I'm drinking from plastic, my breast, if I have this gene, is at slightly higher risk than the next person next to me. Now, if you have this gene and you know about it and you use certain B vitamins, you can feed the gene and make it work better. So you could take someone who's an impaired detoxifier and give them the right B vitamins and make that gene work harder. So if my grandfather had cancer and my father had cancer, but I find out when I'm 15 and I start taking the right B vitamins, I'm going to reduce my risk for cancer. It may not be the answer, it may not be 100%, but there's no question that it's not impacting risks for patients. There's two genes, and I'll let you spell that out there. That's the nickname, everybody. You can spell that out. And it's kind of the accepted abbreviation in medicine. If you tell your cardiologist or your GYN that you have this gene, they're going to know exactly what you're talking about because they are linked to higher risk for heart disease. So cardiologists are aware. They are just linked to issues with fertility. So a lot of fertility doctors are aware. But basically you can have one mutation, you can have one of each mutation, you can have the same mutation from your mom and your dad, which is kind of like the double whammy. Regardless, the treatment is the same. It's to avoid toxins, to detoxify once a year, and take methylated B vitamins. Epigenetics is sort of the field where we think about feeding the genes and cleaning the genes as a preventative step, which is, I think, the future of medicine. The MTHFR gene's definitely been studied with breast cancer. No question about it. There's a connection. We know that. The folate intake of dietary folate has definitely been linked to breast cancer. And then there's this question, is it those patients that have the mutation that maybe? Folate is nature, leafy greens, right? Kale, spinach. That's why I'm such a big advocate for green smoothies. Methylfolate is nature's folate. Folic acid is the pharmaceutical industry realized women needed folate to have healthy pregnancies. So they copied folate. Pharmaceutical industry is never as smart as Mother Nature. I promise you that. So it's not chemically identical, right? So for patients that have MTHFR, folic acid is actually counterproductive. It slows down their methylation pathways and makes them a worse detoxifier. So folic acid, which is still in a lot of prenatals, is something I advise people to avoid. It also can be added to cereals and breads. So just keep an eye on it. Even if you don't know you have it, assume you have it, and just avoid folic acid. All toxins can be detoxified. So probably one of these next couple of weeks, we'll talk about the detox. We'll talk about toxins. I worked with 9/11 rescue workers. I've never seen as toxic a human being as the 9/11 rescue workers. We did supplements, we did diet, we did sauna. They got better, So if they can get better, then everybody can get better. And sauna is something that I advocated for a lot with COVID because this particular virus is so sensitive to heat. And I do think a lot of my patients that if they didn't have a sauna, they did a hot bath, they did a hot shower, I do think it helped kill off the virus more quickly. And then, of course, diet, right? So this is a picture of the standard American diet, which is just plain and simply sad. Anti-inflammatory diet, no dairy, no gluten, lots of leafy greens, fresh, organic, not that hard. Stress anyone. So I think stress is a big trigger for all cancers, for all disease. There was a huge study, I'm not going to remember the number off the top of my head, of the Women's Nurses Health Study, and they followed, lots of women that had breast cancer, and they tracked all the data associated with it. And the very high percentage of them admitted having a very stressful event within the year or two before they were diagnosed. And I do not think that that's a coincidence. I often, I talk to my patients about everything. I get into the nitty gritty. If we don't get to tears, I would say I didn't do my job, because I think that letting go of that emotional stress, letting go of the old pain, helping women deal with that in a more healthy way is very, very important. And I can't underestimate that. I love Reiki. I love meditation. I love deep breathing. Yoga has been my personal savior. I know that it saved me 100 times, but I really feel that stress is a big factor that cannot be ignored. So stress relief is really big. This is just kind of an overview. When I start, I'm just going to move you guys over here so I can see this. Okay. So when women started, we did 10 women did the full protocol. 2 women were my control population. And the 2 women that were the control all they did was the scans and vitamin D. And they got their vitamin D up to the good ratio. So they were definitely, at this point when I did the study, it was between 60 and 100 was the recommended range. It has now been risen to 80 to 100, all the studies are showing. But back then, we got every woman above 60 on her vitamin D. So the control population was just D and scans, okay? Everybody started in the 20s and 30s. And then when we did their follow-up, they were all above 60, 100% of those 12 people. Okay, so this was my first chart. Initial date, fibrocystic. Were they fibrocystic? I kind of did a scale of 1 to 5. Was there any neovascularity in either breast, which is that pattern that shows blood vessels coming to an area? And then I did a pattern like very suspicious was a 5, moderately suspicious all the way down. So most of the women that when we started had a suspicious pattern. Some of them, 4 or 5, some of them 1 or 2, and 1 or both breasts. They were all considered thermographically suspicious on the initial thermography. They all had lymphatic congestion except for 2. All their vitamin Ds were subpar, below 60. They very rarely did a breast exam except for 1 person. Some of them had multiple biopsies. Some of them had 1. So we documented that they'd had prior biopsies. They all had subjective symptoms, which were PMS, cramps, breast tenderness. We documented their use of birth control pills because that is a known risk factor. Over 5 years on birth control pills is known to increase risk for breast cancer. So we just wanted to involve that data in the study. How many months did they breastfeed for? Because we know that the longer you breastfeed, the more protected you are. How many pregnancies? Also, how many pregnancies you have. The more kids you have, the more your breasts are protected. Family history, was there a family history? Some did, some didn't. Age at first child, so the younger you have your first child, the less risk is associated. I think the reasons for that, just to touch on it because I think it's interesting, is we know high estrogens cause the risks for the breast over years. So bad period, high estrogens, risk for the breast. So this goes on for a long, long time. Then it's just more time that the patients are being exposed to those bad estrogens. Pregnancy is a progesterone dominant state. So it's interesting, the women that are very estrogenic, meaning they have those bad periods, when they're pregnant, they're like those happy-go-lucky, yummy, wonderfully happy pregnant people, which I wasn't, clearly. But it's because their body's progesterone dominant for the first time in their lives. So they're so happy and they're so, so imagine if you have your first kid at 20 and then you have 6 kids and you're breastfeeding, that's a lot of years of being protected by progesterone, which is why it reduces our risk. So it's kind of nice to know why that matters. And then we documented their MTHFR status. Everybody had a mutation. We did not check the women that were only going to do the vitamin D because it didn't matter. And then the follow-ups, so that we had the studies, and you could see across the board, everybody's fibrocystic breast got better except for the control population. Ooh, let me go back. How do I go back here? The control population, I was actually surprised to see they had no change. So I still think vitamin D is very important, but their vitamin D alone, even though we got it to the therapeutic range, was not enough to impact the fibrocystic density, the neovascularity, obviously lymphatic congestion, because they weren't doing any manual therapies like dry brushing and things like that. So that was actually surprising. I wasn't expecting to see that in the research, but oftentimes you get surprised by your research. But every single patient had significant change at 3 months, at 6 months, at 12 months, and at 2 years. All the suspicious patterns went away. All the lymphatic congestion improved. Everybody's vitamin D got up to the healthy level, and the suspicious patterns were gone in everybody that I did. So that was like very exciting. And it's just to give you like some before and afters. Like this is what it looks like before. You can see there's a lot of estrogen dominance, a lot of subjective hormonal symptoms, a lot of scary looking patterns. It's sort of like a spider webby sort of pattern, notably improved in this patient, and that was the year follow-up. Again, very scary looking patterns, a lot of hot, a lot of inflammation, notably improved on her follow-up. Same thing here, a lot of subjective symptoms, a lot of that pattern all the way up on the chest, and notably better. So, I mean, you can see these are pretty dramatic before and afters. And this was across the board in every woman that we did. And I will tell you, it's a small study, right? I would tell you it's not even statistically significant because I didn't do enough people, but this is just exactly what I see in my 12 years of doing this now. I see women come in, I've had women come in and cry because every woman in their family had breast cancer, and she got to see her before and after, and she got to see that simple little things that she did made a change in her physiology, right? Potentially reducing her risk. You can see over here, this is that neovascularity pattern I was telling you about, which is sort of like blood vessels coming to fill a little circle. That would be a pattern that we would consider very suspicious. Yeah, so just across the board, dramatic improvements in every woman that we saw. Which was just very exciting. And I do continue to see in my practice every day. And the protocol is so simple. I wish every woman that went for a mammogram was just given a frankincense roll-on. I mean, what's the harm in that? I actually had a patient call me and she was like, I went for my mammogram. You're not going to believe what they said. And I what did they say? And she said, the technician told me my breasts looked great. They looked so much better than last year. And I must be using that frankincense stuff. And I was like, yeah. They're hearing about it out there, but the technicians don't care. They're like, why is this woman getting better and this woman's not? Why is this, they just they're shocked by it. They're excited by it. And the vitamin D is important. It's overall important for your immune system, but I don't think it's enough to reduce the risks of the breasts. So we need to do larger studies. I dream of doing 100 women and 100 controls and getting it published and getting the information out there. This is something that is very empowering for women and so easy to do. This is our website for Thermography. We have a separate website. You can go and learn more. We have some videos and, news interviews and things like that where you can learn more about it. I did mention we're going to talk about detox next week, but we are doing a half off some of the detox kits. If you guys are interested, you can reach out to us in the office. So I want to show real quick. Michelle had sent a question in right before we started with a great article. I skimmed through it quickly, but about vitamin D and vitamin D deficiency. And how it is important. We always think about vitamin D and everybody's always asking about their bones. But it highlighted high blood pressure. It highlighted, digestive issues, colon polyps, which can become colon cancer. And the next page, I think that even talked about MS. And I think it's just a great overview of data suggesting how important vitamin D is. I think vitamin D is going to come out of this crazy time with a lot more awareness. I think it came out of the swine flu with a lot more people aware of how important it was for viral illnesses. I think it definitely accounts for the issue with COVID and the higher incidence of death in patients with darker skin. And it's simply because when you have a lot of melanin in your skin and you get sunshine, you need more sun, more time in the sun to create the same amount of vitamin D. So if I take a nice, fair skinned blonde woman next to a dark skinned, put them in the sun for 20 minutes, the fair skinned is going to get a lot more vitamin D because of the melanin in the skin. So everybody's scratching their heads going, why are we having this higher incidence of death and disability related to this virus? It's vitamin D. It's like they should be giving it out on the corner to everybody. If we were just giving people vitamin D, I think we could reduce the risks for this virus and really minimize what we're seeing out there. And it's very disturbing. So, Michelle, I don't know if going over the article answered your question, or if you have a more specific question than that, but I'd be more than happy to answer it.
I have to look.
Okay. We can take another one if anybody has one.
So there was a question, Dr. Blanche, about can topical iodine be good for men?
Yeah, that's a great question. Yes, I think topical iodine can be good for most people, as long as there is not a, like I said, an underlying thyroid issue. Nutritionists used to do this all the time. They would put iodine little spot on your arm, and they would tell you to just notice how long it takes for the iodine to go away. If your body is incredibly deficient, like literally it'll be gone by the time you hit the parking lot, right? And then as you get more iodine in your diet, it lasts longer and longer. So nutritionists used to have people use iodine, use the spot check. And then when they found that it was lasting like 6 hours before it went away, they would pull back on the dosing. So it is something that you can do at home. It's kind of like a fun experiment. You paint a little spot on, you see which family member goes away quicker. We have a little bit more scientific way of checking iodine, where we do a 24-hour we do a 24-hour urine collection. We give you a measured dose of iodine before, and then we see how much iodine your body lets go in the urine. So obviously, if somebody's incredibly deficient, their body's not going to let go of very much iodine in that urine test. But if they are, their iodine's pretty good, they got some good stores, then they're going to get a lot more iodine in the urine test. That's the more scientific way to do that testing. I always go slow with iodine. So I do 4 drops of Lugol's iodine in water to start. And I do that for a few months. And then we can lower that down to 2 drops. And I do that 1/4 size spot on the breast and blot it with a tissue so you don't get it on your clothes. It does stain, so I don't want to be responsible for that. But the iodine in water is pretty safe for everybody, and it will give you that dietary dose of iodine. And it's, like I said, it's not really going to be harmful. I always go slow because fluoride and bromide attach to the same receptors as iodine. So if somebody's super toxic and they had a lot of fluoride as a kid and they're drinking, tap water that has a lot of fluoride, if you give like a big dose of iodine, you're going to push off that fluoride, and that will feel bad. So that's why I always like 4 drops is very low dose. You're not going to hurt anybody. But I've had people not realize that and read somewhere to take a lot of iodine, and then they feel really awful when they take it. And that's because they're literally like detoxifying all that fluoride, and that can be not good for you. So you want to go slow. And, Lugol's iodine is safe for everybody. A couple drops in water, paint it on your breast, 1/4 size spot. As long as there's no underlying thyroid issues or obviously iodine allergy, then you should be good to go.
So to touch upon the part where you said about iodine may make you feel a little sick, I had one person mention that iodine topically she can take, but then when she takes it internally, it makes her dizzy. And
that's interesting. So it may be too much. The other thing is, if you had an autoimmune condition and you took iodine, hyperthyroidism feels like palpitations, anxiety, like too much energy. So that might be an idea of getting screened to make sure there's no underlying thyroid issues. And that's a test any doctor can do.
Another question that I had was, what sunscreen do you recommend for kids?
It's a great question. Everybody knows I'm very bad with remembering brand names. But I just donate. Every year I do this. I donate to the EWG, which is Environmental Working Group. I donate $50, and they send me this awesome basket of all the highest rated safe sunscreens available. And then I try them because, I don't like the pasty white where you put it on, you look like a ghost. So I try them and I pick which one I like, but I feel complete. And they have a great website, the EWG. They screen, they rate all the sunscreens. So you can go on there and just see which brand they recommend is number 1, 2, or 3, or you can order this great little $50 basket of sunscreen and try them out and see which one you like, the smell, the taste, all that kind of stuff. That's like my cheat for sunscreen every year, because they get, they're getting better and better every year. So there's a lot of options.
Absolutely. Another question that I had was, do we need to take vitamin D if we're outside in the summer right now?
Yes. So I used to tell people to take like 2,000 to 4,000 during the winter and stop it in the summer and just get some sun. I haven't said that in 3 years. I really don't see, at least, so this is based on the last 2 years. I didn't see any impact from the sun in the last 2 years. I had lifeguards that were not wearing sunscreen. They were in the sun all year, all summer, 5 days a week, did not bump their vitamin D. I can say that for the tri-state area. And I think it's a pollution issue, because when my patients went to Europe and they got sun, they came back with higher levels. So I did like mini experiments with my patients. So going to Europe, which is a lot cleaner, they did get bumps in their vitamin D from sun exposure. Now, I don't know what's going on this year. Like I said, I got sunburned, right? We spent the 9 weeks in the house, the whole world, and the planet is definitely cleaner. They can see it from space, right? So I am expecting this summer to be the first summer in 3 years that I think we might be seeing some higher levels, right? If you get sun, it used to be 20 minutes in the sun would be like 20,000 of vitamin D. That's really not been relevant in the last 3 years because of pollution. So we have to wait and see what this year brings. So I used to say, don't even bother stopping it. I didn't even lower my vitamin D in the summer, but this year could be different. We may want to bump it down a little bit and just kind of be aware of your sun exposure and then come and get the level checked, because I think that this is the first year in years that we're going to see the sun will make a difference.
Okay. And then is there a vitamin D that you recommend for kids, or how much they should take?
Actually, I can put it in the follow-up email with the link to the PowerPoint and the video. I should have included it, but I recently got a great chart for kids based on ages and vitamin D recommendations that I felt were really valid. So I will send that in the follow-up email. It really depends on the age of the child.
Do you have any recommendations to detoxify with MTHFR?
Yes. So, methylated B12 is very important. I like to use a sublingual under the tongue because it goes right in the bloodstream. Methylfolate is also the B12 that I use, has both B12 and methylfolate under the tongue. B6 can be helpful as well. I always recommend my patients do the cleanse. It's like a 21-day. I have the girlfriend cleanse, the man up detox. Basically created a program where it's like videos every few days, emails every few days. I kind of want to go home with people and teach them how to do detox the right way, because I've seen a lot of patients get sick from doing detox the wrong way. And so that's something that that's why we're offering half off on the old cleanse, because I'm revamping it for September, because I kind of told people to pause on detoxing, because I know when you detox, even though it's so important for you, when you're doing it, it's a little bit stressful on the immune system. Now, if you've already had the virus and you and your husband have been drinking too much wine, now is the perfect time to do the detox. But if you're still in that situation where a lot of people are drinking too much, if you're still in a situation where you're still afraid of getting the virus and you want to be cautious from that perspective, then I would hold off and kind of look towards September, when things really we're sure they've died down and everybody's kind of moving on to the next phase. Only because I do know that detox is a little bit stressful on the immune system. And right now I don't want to put any stress on anybody's immune system who's still at risk.
Now, COVID seems to be a vascular virus. Does vitamin D help with the vessels for that?
I'm not sure. It's definitely a vascular virus. I think MTHFR could be a factor there, because MTHFR patients have tendency to become coagulopathic, meaning they can clot easier. And this virus seems to be causing clots, not in everybody, but in some people. So I kind of wonder if those patients that had issues with stroke and clotting issues maybe were MTHFR and they didn't know about it. Regardless, if you take the B12 and the folate under your tongue, you've treated your MTHFR, right? So I believe if you do that and you're taking a really good fish oil, which is very good for blood vessels, that is kind of the, like I had, knock on wood, I had no patients get vascular complications. And all of my patients were taking their methyl B vitamins under their tongue, their vitamin D, and their fish oils. And not one got a vascular complication. And a lot of these patients are MTHFR. But if you're taking your methylated vitamins, you're treating it. So it's almost like, not that you can make the gene go away, but you can negate the downstream of bad effects of having it, if that makes any sense.
So now if you had the antibody test and it was negative, does that mean you're not a carrier for COVID?
It's a great question. I have no idea. Betsy and I are banging our head against the wall with this antibody test. I honestly don't know. I have whole families. I know with certainty definitely have the virus. My mom comes back with the antibodies. Nobody else has them. I have families that were living in a home with somebody with the virus. You know, did they get it? Did they not get it? Nobody has antibodies. I don't know. I think some people could have potentially been exposed and not gotten sick. You know, just like with me, with the flu, like I haven't had the flu, I don't think ever. And I'm not afraid of the flu. So was I around COVID and I couldn't get it? Maybe, I don't know. Are some people making antibodies and other people aren't? It can happen. You know, I mean, you can have chicken pox and you can get chicken pox again. You know, did your body not make enough antibodies? It's very hard to say. And I will say with this virus, just like every other component of this virus, it's a complete mystery to me. It makes no sense. It follows no laws of nature. So I can't answer the question, which is frustrating for me.
Do you think everyone should be taking fish oil?
Yeah, unless you have a fish allergy. I think fish oil is really good. Be careful with brands. This is one of the ones I really care about, brands. It should be a good quality brand where you know they're screening for heavy metals. It should come from things like anchovies and sardines because they're literally small fish. If you pick up a fish oil and it comes from tuna, there is no clean tuna on this planet, right? Tuna is a big fish and there's a lot of mercury. You have to remember they're not obligated. Not every company checks for these things. A lot of them don't care at all if it has mercury in it. So, and they can falsely label the bottles, you know, so you have to be very picky with fish oils. Good quality fish oil coming from anchovies and sardines, definitely the way to go. And I think little kids, kids with any kind of ADD issues, really powerful effects with a good fish oil.
So now with the quarantine and drinking and having fun, we have our little vices and we want to cheat every now and then. Do you have any recommendations for a good sweet snack or a salty option like dark chocolate or popcorn, or since we can't have our chips and cream?
Yeah. So, I mean, listen, you got to live. So I'm always a 90-10 girl. Once we get you good, when you live the 90-10 life, you're going to be fine. The little bit of cheat here and there to bring you pleasure is not the end of the world. You know, I think there's a lot of gluten-free salty snacks. I'm a salty kind of person, so there's a lot of gluten-free salty snacks that work for me. I mostly do like pickles and I need that crunchy. So pickles, olives, that kind of stuff. You know, the dark chocolate, obviously good dark chocolate is going to be much better than any of the other candy. I always worry just about nothing every day, you know, like don't get a little bit of chocolate every single meal. So it adds up and it's a lot of sugar and people kind of kick up that yeast and the candida and then the sugar cravings take over. So I think it's really everything in moderation, you know. I think that's the most important part.
Do you recommend a different type of fish oil for the kids or can they use the same as adults?
I like Nordic Naturals for fish oils for kids. They have a lot of they're a very clean company and they have a lot of different options. They have liquids, they have, you know, gummies, they have chewables, like kind of for every kid kind of need. And they taste pretty good.
I think that's it with all the questions.
That's it? Sure, everybody got one? All right. Well, listen, I hope that this was fun. Let me blow you guys up again so I can see everybody's faces. Oh, I got to stop sharing. Hold on one second. All right. So I hope this was great. I hope everybody learned a lot. You know, you can always send questions through email after the fact if you want to. And I hope everybody gets their thermographies and they tell their friends to get their thermographies. We are open for thermographies in the Mineola office. We started getting people back. They're slowly creeping out of their houses as they start to not be afraid so much. But I look forward to seeing all your shining faces at some point soon. And I hope you guys are doing amazing. And we are going to be here next week. So bring friends. Bye, guys. Thank you.
Bye.